from the mountains of Mongolia to the islands of the Philippines, and from the least developed countries to the highly developed ones, the Western Pacific region epitomizes diversity. This diversity is reflected in the region's health sector too. Poverty, population density, and geography make the region vulnerable to the emergence of new and epidemic-prone diseases, natural calamities and disasters, and disease outbreaks. Rapid urbanization, industrialization, and globalization have further increased the health risks. Since the past 60 years, WHO has been assisting its member states to effectively respond to these challenges and forge better health systems. WHO has been striving to ensure quality health care to all. How do we achieve desired results? Focusing on country needs, forging partnerships, responding to crises, strengthening health systems and national capacity, raising awareness, promoting implementation of international guidelines. Focusing on country needs, WHO representatives and staff at the country offices work hard to ensure its assistance is aligned to the country needs. They work closely with the ministries of health and hold regular consultations and strategic dialogues with national authorities and other stakeholders at the country level to identify country needs and the government's priority areas. WHO representatives and staff often travel to far-flung places to assess health situation and identify the needs, particularly of the disadvantaged and vulnerable groups. Forging partnerships. WHO recognizes that for the countries to achieve health-related Millennium Development Goals and other health-related targets, all stakeholders must work together. WHO representatives and staff at the country offices play a major role in creating complementarities and synergies with other partners. In each country, they work with the Ministry of Health and other stakeholders, including various UN agencies, NGOs, and the communities to plan, implement, and monitor health programs to ensure targeted and effective assistance. Responding to crisis. Natural disasters occur without warning. Disease outbreaks can happen anytime, anywhere. The region has experienced significant outbreaks of newly emerging diseases, such as severe acute respiratory syndrome and avian influenza in the past. Some have re-emerged and caused pandemics such as H1N1 influenza. The region also witnesses regular outbreak of known communicable diseases, such as dengue, typhoid, and cholera. At times of crisis, WHO country offices are at the forefront managing emergency and humanitarian assistance, trying to save lives and prevent impact on people's health. Their work does not end there. They continue managing information, assessing trends, and comparing performance of health systems to improve preparedness to crises and outbreaks. Strengthening health systems and national capacity. Strengthening public health systems is one of the main agenda of WHO. WHO country offices continuously provide technical and policy support to the member states for building sustainable national capacity in the health sector, from building capacity to tackle disease outbreaks, to strengthening capacity to manage all types of crises, from improving capacity to develop national health planning, to strengthen capacity to analyze health sector financing work. The country offices prioritize work aimed at building national and institutional capacity and health systems. Raising awareness. Many of the region's diseases could be prevented and deaths averted through heightened awareness. WHO staff at the country offices engage in extensive awareness raising and advocacy campaigns to promote healthy living, while raising awareness about the importance of immunization, nutrition, and proper newborn care practices. These campaigns also encourage communities to adopt healthy lifestyles and to create healthy settings approach. WHO staff from the country offices ensure that these campaigns reach the remote and rural places as well. The intensive campaigns have led to significant reduction on mortality, and in some cases, elimination of diseases. Promoting implementation of international guidelines. WHO is a leader in producing global health norms, standards, and guidelines. The country offices play a vital role in setting, validating, monitoring, and pursuing the proper implementation of norms and standards. WHO representatives and staff engage in rigorous dialogue with the ministries of health and other relevant stakeholders to promote adoption and implementation of the international agreements, such as International Health Regulation and the WHO Framework Convention on Tobacco Control. Their efforts have paid off in many countries where these are now fully implemented. What have we achieved? The number of people dying from lack of access to health facilities has significantly reduced. The Western Pacific region is now free from poliomyelitis. Leprosy is no longer a public health problem, and the region is moving toward elimination of several other diseases, including measles, maternal and neonatal tetanus, and in some areas, malaria. Despite significant progress made in the past, we still face critical challenges. The health of populations around the world is threatened by climate change. Newly emerging and re-emerging diseases are proving to be a constant danger, and non-communicable diseases are becoming a growing problem. Lack of universal health insurance coverage and inequitable access to integrated, comprehensive, and quality health services remain a significant challenge in many parts of the region. However, these are not insurmountable. We can overcome these challenges by putting in place strong health systems to achieve the Millennium Development Goals, address rising health care needs for non-communicable diseases, and ensure access to health services during disasters.